Organizations often try to manage complex processes using a combination of spreadsheets and shared folders. Spreadsheets are great to get a quick result, but they can lack the controls necessary for a critical business system. Using disparate spreadsheets can result in data capture errors, duplication of work, inefficiencies, and lost or missing information. Legislation is requiring companies to comply with new privacy laws. Privacy is a major consideration when selecting and implementing a system, especially if you are dealing with occupational health and medical information. Key personnel changes can sometimes mean that vital experience is lost. Sometimes, informal electronic scraps of paper break down when the original developer leaves. Changes to procedures are difficult unless there is a single integrated system. An automated system can schedule appointments and send automated reminders. This can be very difficult when using a manual system that relies on people to remember to check data and initiate appointments manually. Critical appointments can be overlooked. Dynamics 365 by Microsoft is an integrated business system that empowers people with the right information to do their jobs. The system improves visibility and enhances decision making. It will help to unify and automate your business processes. It also provides the necessary controls and governance to ensure compliance with privacy legislation. Axnosis has developed several modules within the Dynamics 365 environment. These modules include OHS365 for the management of occupational health and safety. Compliance forms part of the GRC 365 module. All of these modules are integrated and use the same user-friendly interface across the entire system. In this series of video demonstrations, I will show you how Dynamics 365, together with the Axnosis solution for occupational health and safety, can be used to manage health assessments and medicals for a critical role in a volunteer service organization. To somebody unfamiliar with an integrated business system such as Dynamics 365, the information on the screen may feel a little bit overwhelming at first. But not to worry. I have configured myself as an administrator, and administrators can see all areas of the system. We've done that for the purposes of today's demonstration to give you a feeling of the full power of Dynamics 365. It is an integrated business system, and there is a common database shared across all of these different functions, which means in practice that different departments such as human resources, as well as the occupational health and safety people, all work on a common set of data. What you see on the screen is a typical list of workspaces that are relevant to specific roles within the company. We are going to focus during the demonstration today on occupational health and safety. Clicking on that link takes me to the occupational health and safety workspace. This type of workspace is very typical across the rest of the system, and that's another advantage. Having everything developed using a standard look and feel and layout makes training of end users far easier, and people can move between modules and different parts of the system without needing to be retrained. Once you get familiar with the way a system works in one area, it becomes obvious how it's going to be working in other parts of the business. On the left-hand side of a typical workspace, we have some shortcuts to common transactions. We have some key indicators of how things are, and we have some lists on the right-hand side which we can filter on to get different views on the data that's in our database. The other way of navigating around the system is through the menu on the left-hand side. We've just had a look at workspaces. What is new on the left-hand side here is modules. Today we're going to be focusing on occupational health, but you can see within the general safety, health, environment area, we have a number of different areas. And you can see environmental, safety, security, permits, inspections, incidents, etc. Having all of this information in a single integrated system is a massive advantage because information is only captured once, a single version of the truth in the system, and everybody shares the same data. Our example organization, Consultation, is a public service charity that saves lives at sea. Volunteers provide essential services along the coast of the United Kingdom to rescue people at sea and to save lives. Consultation has a special duty of care to all volunteers. Volunteers that are involved in patrols and rescues need to pass routine health assessments that are scheduled every 2 years. It is vital to track the records of the volunteers and ensure that they are fit to work. Any health issues need to be attended to, and the volunteer can only be placed on duty in a role that is suited for their physical condition. We will follow how Consultation tracks the health of Peter O'Leary, who has been involved with rescue missions for many years. Let's get back to our scenario with Peter O'Leary, our volunteer. Peter's information is kept on file within the HR system with Inside Dynamics, and it's also accessible through the occupational health side. What we do to get to Peter's information is we navigate on the left through the modules to the Health, Safety and Environment area, and we go to the worker link. This would show us a list of all of the workers that are configured in the system. You can see on the worker type column that these have been classified as employees. In our scenario, we can also accommodate volunteers and contractors. To get Peter's information, we would type Peter here. You can see that there are 4 Peters in the list, and we click on Peter O'Leary. These tabs can be opened up one at a time or all of them as you wish. So we have worker summary, we have the address information, contact information, and so forth. On the right here, we have employment, compensation, competencies, and so forth. So looking at the worker summary, Peter was hired in 2015. He does not work from home. He's located in Cornwall West. Peter's address information, this is where he lives. His contact information shows his phone number and email address, and other personal information. For example, we have links to his bank accounts, his identification numbers, and all of the other typical information that you would find in a human resources file. What we can also see on the top here is that we have information around payroll, compensation, time records, and so forth. In our specific example today, we're looking at the health and safety side, and that opens up a number of links at the top, one of which is to capture Peter's fitness as well as medical consultations. When Peter started with Consultation, he had to complete a self-declaration that he was fit. Peter also needs to be scheduled for follow-up medicals every 2 years. Next, I'm going to show you how we can interrogate the system to get a copy of Peter's pre-employment screening form that he filled out. On the top right-hand side here, you can see a little paperclip with the number 1. This means that there's a single attachment to Peter's record. If I click on that, it will open up a view of that particular file, as well as some information about it. So we can see that it's his pre-employment medical declaration, and the system will show a preview of the scanned document. The example I show here is a blank form. It is just to show the principle. We can attach as many of these files to Peter's record as we like. We can attach external documents, whether they are contained within SharePoint or whether we retain the actual file with Inside Dynamics. They can all be found using the paperclip link at the top right. One stormy night, Peter was involved in an incident at sea. As the boat lurched over a swell, he fell backwards against a large piece of rescue equipment that had been left lying on the deck. As a result, he hurt his back. The incident is recorded by Occupational Health when the boat returns to shore. Sue, who works in Occupational Health, receives Peter for an interim health assessment as a result of the incident. Sue inspects Peter's file in Dynamics and can see that there's at least one previous report that he had a back problem. She also looks at the self-declaration that Peter filled in when he first started. Sue refers Peter to a back specialist. The specialist works at the local hospital. An appointment is confirmed, and Sue books Peter with the specialist. Next, I want to show you how easy it is to get access to Peter's current fitness. On the worker screen, on the top here, you've got health and safety, and that opens up this tab with a fitness link where I've got my cursor. If I click on that fitness, I get access to his current fitness record, and I can view or make necessary changes here. The sorts of information are things like his body temperature, heart rate, blood pressure, any preconditions. And here's our first clue for our scenario that there was a precondition of back pain. We can see his current position, where the fitness evaluation was done, who the doctor was, and the outcome. In this case, he's been marked as completely fit. So this is a very simple overview showing Peter's current level of fitness. And what we can see here is that there is a record in the system that there was an issue around back pain. Next, I'm going to show you how we would schedule a medical appointment for Peter for the future. We do this by opening our menu again, and we can see that we've got a shortcut link here to creating schedules. The scheduling system within Dynamics 365 is extremely powerful and can schedule across most of the system for the future. In our specific example, we're going to schedule a medical appointment. We're going to select the department. We're going to select the job. We're going to specify the date. We can add additional information around the site, and then we must point this to Peter O'Leary. And click OK to run in the background. Peter is reminded by email of his appointment. He also receives an SMS. With this, he duly arrives at the hospital to see the specialist. Next, I'm going to show you how you can access Peter's medical results from his worker record. This is done by looking at the top again to the health and safety option, and then on the left-hand side here you see a link to all medical results. Clicking on that link takes you to a list of all the tests that were done and any high-level information relating to that test. The specialist fills out the case details. Specific medical tests will also be required, and these can be scheduled. Next, I'm going to show you how a medical consultation is recorded inside Dynamics 365. From the worker record, we can navigate on the top to the health and safety item, and then on the left-hand side we see a consultation link. If we click on the consultation link, it will take us to a list of all prior consultations. If we click on the most recent one at the bottom, we can see that Peter was attended to at the Wadebridge Medical Clinic by Martin Ellingham on the 1st of December 2021. And there are some notes here. Patient presented with back injury, and then there are some notes here relating to a pre-employment precondition back injury. There are many fields here that can be filled in. In this particular consultation, his weight was measured as well as his height, and there was a urine test done. The conclusion at the bottom was that the back injury needs time to heal. The patient should be avoiding physically demanding activities and be put on administrative duty for 6 months, and his work fitness status is now temporarily unfit. Access to the system from a security point of view is configured during the project and allows people to be entering and reviewing information in the system from multiple locations, including those people that are working at home, people that are working in clinics and hospitals, and people that are working out in the field. Using the system, Sue can see that the case log has been updated, and she can view all of Peter's history. She notes that Peter has a history of back problems, and concludes that he is not suited for working on a vessel, certainly not in a search and rescue role. Sue contacts Peter's supervisor and advises Peter to stand down for further treatment. His records are updated to reflect the changed role. A reassessment is scheduled for 6 months' time using the system. Should there be a need for a specific medical test to be done, then this can be scheduled, and when the results are available, they can be captured into the record. To show you how that works, I'm going to navigate on the left-hand side to our Occupational Health and Safety module and click on the link to all medical schedules. This opens up a list of all of the schedules in the system, and they are in different statuses. Our sample information here shows that most of these have been created, but a number of them have already been approved. What this means is that we can require approval of a medical test by a higher authority in the system, and this can be done through a workflow process. Once a schedule has been approved and the examination is complete, you can record the results easily from the same screen. Select the item that is in approved status, click on the medical fitness shortcut at the top, and you will see a panel sliding to the right, which allows you to capture the outcomes of the examination. We can see a number of fields on this panel. These have been configured for your organization during the project, but would typically include things like temperature, eyesight, heart rate, blood pressure, etc. What we can also see is the clinic where the test was done, who the medical practitioner was. We can also see the assessed fitness status. In this case, we see that the worker has been marked as completely fit, but a number of different options exist here. If the worker has been declared to be unfit, the incapacity outcome can be recorded by selecting the appropriate option on the right. Once these fitness values have been entered, you would click on OK to commit them to the database and record that result against that specific schedule. This then becomes part of the permanent record of that specific worker. After 3 months, Peter is bored and he mentions to his new supervisor that he's feeling stressed in his new role. He is assessed again, and it is recommended that he takes a leave of absence. Human resources need to get involved, and they update his file with details about his sick leave and benefits during this time. After a month, Peter meets with Jane at HR and complains that he needs to be active. Jane identifies from his file in Dynamics that the stress is likely the result of his back problems and his new role. She can see a number of cases in the system to confirm her theory. She asks him to return in a month. So next I want to show you how we would record the transfer of Peter into a new role within our system. So again, we start from the worker view, and we're on Peter O'Leary's record. Instead of the health and safety, we're now going to move over to a new tab at the top here, and we're going to look for worker position assignments. Before I click on that, just a comment. So if I click on the worker position assignments for Peter, I can see that he's currently in the role of a lifeboat station volunteer. What we need to do is we need to add a new assignment, which can start immediately and which can run through until 2022 for a year. We can assign the position now to some administrative role. From the pre-configured list, I haven't got a good example, so I'm just going to make it a vaccination administrator for now. And then the reason code is going to be a lateral move. What we then need to do is initiate a workflow to have this transfer approved. There are some warnings which relate to the data that we have in the system currently. So what we have done is we've now submitted a request for transferring of Peter into an administrative role, and that request will then be approved and then reflect on Peter's worker file. With time off, Peter recovers well from his stress. He meets Jane again. Reviewing the history and recommendation from the medical assessments, Jane concludes that he is once again fit to return to work in his office role. Sue and Jane agree to schedule a follow-up appointment for Peter in 6 months. In 6 months, Peter receives a reminder by email and SMS to confirm that his appointment is due. He goes to the local GP, who has access to the dynamic system and can capture the results of any assessment in Peter's file. The completed assessment is routed to Occupational Health, who agree that Peter is again fit for active duty at sea and updates the record. At all stages, Peter is able to log into Dynamics HR self-service and view his own file. In order for Peter to go back to active duty, we need to make sure that he's screened for COVID. I'm going to show you how we do this within the system. We start off from the worker view. Again, we select Peter O'Leary. And this time, on the top right-hand side here, we look for screenings. If we click on that link, we can see a list of the screenings that Peter has undergone since he joined the organization. starting with his pre-employment drug screening, and then he's done 2 COVID screenings since. If we want to add a new screening, we will just simply click on the new button. We will select the type of screening that we want to do, select COVID, and then we specify the date which it needs to be done by. Once we save that, Peter will then be able to go in and declare under the questions section whether he's been in contact with anybody with COVID. He has, in this case, been to a healthcare facility for his back problems, and he can commit that. This record of screening is now against Peter's name and is available within the system. The Axnosis OHS365 system also allows you to keep a record of vaccination certificates. With COVID, this has obviously become a very important requirement. From the Health and Safety and Environment menu, we look for reports and we look for vaccination certificates. In our system, we have only one vaccination certificate, and it's under the name of Moritz Kruger. If we select that and click on print, what the system will do is print out a report for us. The report looks something like this. Obviously, this is customizable to the organization. So next I'm going to show you how we would capture the lifeboat incident inside our system and initiate an investigation. This time I'm going to start from the front page and navigate through the workspace shortcut. I click here on Occupational Health and Safety, and I get taken to the Occupational Health and Safety workspace. On the left-hand side, I would then click on Record a New Incident, and I will get some information to fill in on the right-hand side. I'm going to fill these out, and then we'll discuss them. So I filled out the basic information relating to this incident, and just to show you, we've got a description. We recorded the date and time. We recorded the incident type as being an accident. The location has been on the Cornwall West Coast region, the name of the person reporting the incident, and then we've done some basic cause analysis. So when we complete this, we will then be taken to a screen where we can fill out the rest of the information. Here is the screen showing all of the information relating to the incident. The person reporting the incident normally doesn't have all the data and all the information at hand, so this is then captured after the event by somebody typically in the safety department. After a year, Sue has retired and she has been replaced by John. John can see the entire case history in one place inside Dynamics. John looks at the incident and decides to initiate a risk assessment for the activity that Peter was involved in, as there have been several similar incidents. John initiates an investigation from the original incident. The risk assessment is then captured in Dynamics and shows that injuries at sea can be avoided by ensuring that loose items of equipment are always secured below deck. An action plan is created from the risk assessment and assigned to various people to ensure that the standard operating procedure is updated. Derek is assigned the task to investigate and recommend a new way of securing rescue equipment at sea to reduce the risk of injury. Derek can record his recommendations against his action plan, and the system tracks that all items are completed. Having captured the basic information about the incident, it would typically be reviewed by somebody in the safety department, and at this point we would definitely want to record the fact that there was an injury and that Peter O'Leary has been hurt. So on the incident details screen, I'm going to go to the incident tab here, and one of the sub tabs here is the workers injured link. What I want to do here is I want to click on create injury, and I want to record the fact that Peter O'Leary has been hurt. So you can see some of the case description has come through from the incident description, the worker, and just search on Peter, and there we have Peter O'Leary's name. We just select that. The date and time of incident has been filled in already, and then we fill out some other information relating to the nature of the injury and the body part. So on injury or illness type, we're just going to select injury. On the body part, this is now his back problems again, and the outcome type is that we need to restrict his work, and the information is then recorded against that particular incident. Now that our incident has been recorded, I just want to show you how we would view that injury from Peter's worker record. So again, we look for Peter O'Leary in the list of workers to go to his personal file. And then under the worker tab at the top here, we have personal information, and we have a link here to injury or illness incidents. If I click on that, it then opens up a view of all of the incidents in which Peter has been recorded as having incurred some injury. In our example, we only have the one, and on the right-hand side, we can see all of the information that was pulled from the injury record and is now part of Peter's personal file. There is a lot of additional information. For example, the worker's supervisor, details about the incident. I haven't filled out everything yet. This is still under investigation. And you can see that we have provision for the costs relating to the injury, any treatments, any filings that need to be done, anything that's under the legislation that needs to be recorded, and then any further details about the injury or illness. Next, I want to show you how you would assign an activity or an action to somebody else based on an incident. So we start from the Finance and Operations main menu, and we click on Occupational Health and Safety, and we go through to the Occupational Health and Safety dashboard, from which I can go and click for convenience on the incidents recorded by me. And our lifeboat incident is here, so we would click on the link there, and it takes you through to the incident details screen, again, where we can continue to fill out information. Down towards the bottom here, we have a conclusions section, and we can go through to the activity, and here we can capture the information relevant to this particular action. So on the due date, what I want to do there is I want to assign it to, let's say, the end of next week, and I want to record some information here, which I'll do and come back. So what I filled out here was the due date. Then the description was to review Peter O'Leary's temporary assignment. He's now complaining of stress, and I've now assigned that to Jody Christiansen, and the priority is then set as high. So once we have filled out that information, that activity will now be routed through to Jody's list of tasks, and she can attend to it and feedback on that. Next, I want to show you how Sue and Jane can do a system inquiry on Peter O'Leary's fitness to work records. So that would be done from modules link. Under Occupational Health, Reports and Inquiries, and click on All Medical Results. So here we need to put a few filters in just to narrow things down a bit. So I'm going to put in Peter here. And immediately we can see that we've got a number of test results in the system relating to Peter O'Leary. We can also filter here on whether it was a ad hoc or scheduled medical, or whether it was a fitness assessment. From this point, the results can be exported to something like Microsoft Excel. We would do that by clicking on the relevant link at the top here, and we would open this table inside Microsoft Excel, and all of the information in these records would be put into a spreadsheet, which we can then forward to an external party who might not have access to the Dynamics system. In these demonstrations, we have seen how Dynamics 365, together with the Axnosis OHS module, can eliminate the problems experienced with disparate spreadsheet systems. At every stage in the process, information is securely stored and made available to those who need it. The system allows appointments to be scheduled and proactively reminds people in advance. Dynamics 365 allows medical practitioners outside of Contosa to also have access to relevant and important information about cases and their patients. The self-service capability allows Peter to see all his information in one place, ensuring transparency and allowing him the opportunity to correct any errors or any missing information. Overall, the system has improved communication and productivity, while at the same time improving safety, reducing risk, and ensuring compliance with complex legislation like the privacy regulations.